Hi, I'm Derek Wright. I'm the Interim Chief Executive at Waikato DHB. This message is for the DHB staff and for our wider community. As you know, this DHB has gone through a fairly difficult period, pressure on our services, pressure on beds, and it's time for us to actually look at the next 10 years. So I'm really excited to tell you about the 10-year health system plan that we're about to kick off. What this plan will do is identify what services we require over the next 10 years. Which will obviously then guide the staffing that we need, the building that we need to do, and what the models of care are going to look like for the future. If we keep doing the things the same way in Waikato, we're going to need at least another 440 hospital beds by the year 2036. We would need to staff these beds. We would need to increase our diagnostic capability and create more technology. We have one of the highest percentages of Maori in the country, and over 60% of our population is rural. Yet Maori and rural people have poor access to services. This is not acceptable. We have a growing and ageing population, and we're seeing more complex and chronic illnesses like diabetes, cancer and heart disease. We have to do things differently to cope with the demand while living within our means. Traditionally, health system planning has been done mainly on what the DHB is going to provide. But this is an opportunity for us to look at the whole system, because the provision of health care in the Waikato doesn't just come from the DHB, it comes from primary care, it comes from non-government organisations, comes from rest homes, comes from community pharmacies, and a whole range of additional health providers. So we need to make sure that we engage with all the stakeholders who can input into this plan, which includes obviously a number of the organisations that I've just mentioned, but also includes our staff, and more importantly, it includes our community. The health system plan will bring together a number of strategies and plans that many of you are or have been involved in. This will align with regional plans under development. A key plan supporting the health system plan will be the Waikato Care in the Community plan. Ernst & Young, often known as EY, will work alongside us to develop this. Once completed, the health system plan will really be a roadmap for the future. So it will help us to identify what's health going to look like over the next 10 years and what's the changes that we need to make in our models of care. The plan will have clearly defined actions with a timeline to be delivered in the first 3 years. Obviously, as we continue to develop this plan, I'm keen that we continue to engage with you and also keep you updated. So we'll make sure that there's information on our website about how you can engage, how you can get updates on where we are with the planning. I'm really keen that the community is involved in this, because at the end of the day, this is your plan. So we're your DHB, we're here to look after your health needs, but we need your assistance if we're going to get it right over the next 10 years.